Hey there, gentlemen. If you're in your 50s, 60s, or beyond, and you've started to notice that something about your intimate moments has shifted, specifically, if you feel the entire wave of pleasure that comes with climax, yet the seminal fluid you expect simply isn't there, then what I'm about to share matters enormously for you. Perhaps this happened to you a single time and it immediately planted a seed of anxiety that's refused to leave you alone. Or maybe it's something that keeps repeating, a private struggle you've kept to yourself, wrapped in embarrassment or a quiet dread about what it could mean for your health, your identity as a man, and the road ahead. My name is Dr. Narita, and I'm a urologist who has spent the last 12 years dedicated to men's health at every chapter of life. Today, I want to sit down with you for a conversation that's honest and thorough, but also deeply reassuring, one that won't sidestep the subject or leave you walking away with more uncertainty than clarity. First and foremost, I need you to hear this clearly. I understand exactly what you're going through. This shift your body is showing you is not proof that your manhood has run its course, nor is it some judgment on your value as a man. Look at it from a different angle. This isn't a breakdown. It's a precise signal your body is trying to communicate, and all that signal requires is that we translate it correctly. Keep watching, because over the next few minutes, we'll walk through the unexpected reasons behind this, the serious red flags you must never brush aside, and most importantly, the straightforward, treatable options that modern medicine provides to bring back your calm, your self-assurance, and your overall sense of wellness. Before we get into what's happening when fluid doesn't show up, let's take a brief, plain language walk through how this process is designed to function. Picture the reproductive system inside your body as a finely tuned musical ensemble. The testes generate sperm. The seminal vesicles supply the majority of the thick, nutrient-dense fluid. The prostate chips in with a protective, alkaline fluid that helps everything survive the trip ahead. All of these components come together and collect in the urethra, poised for release. The instant climax occurs, a set of muscles fires in a rapid, rhythmic pattern that pushes this combined fluid forward and outward. It's a swift, almost instantaneous event, the outcome of an intricate, perfectly coordinated dance between your nerves, glands, and muscles operating as one. Now here's something essential, gentlemen, and I really want this to sink in. Climax and ejaculation are two entirely different events. Climax is that intense wave of pleasure controlled by your brain and nervous system. Ejaculation, on the other hand, is the actual physical release of fluid. For most of your life, these two things have unfolded together so smoothly they felt like a single moment, but underneath, they're powered by completely separate systems. Grasping this difference is the very first step toward letting go of the fear and embarrassment that so often comes wrapped up in this experience. What we're zeroing in on today is known as dry ejaculation. This is the clinical name for when a man experiences the full sensation of climax but observes minimal or no fluid release. Patients often bring it up to me as an empty orgasm, and I can hear the bewilderment and frustration in their voice every time they say it. That disconnect between what's expected and what actually happens is what drives so much worry. And I truly understand why. You've spent your whole life associating a physical sign with this experience, a visible marker that something happened. But here's the crucial part. Your capacity to experience pleasure can stay entirely unaffected, since that's governed by your brain and nerves. What's changed is the mechanical delivery system. This does not mean your virility has faded away. It simply means that a portion of your body's internal plumbing has a specific, identifiable explanation behind the change, and in almost every case, it's something we can manage. Quick moment before we move into the leading causes. If you're finding value in this, tap that like button so YouTube knows this content is worth sharing. Hit subscribe to become part of our expanding community of men who are actively taking ownership of their health, and leave a comment letting me know where you're tuning in from around the globe. I love watching this brotherhood of support stretch across continents. It genuinely means a lot to me. Let's now unpack the 3 leading reasons behind dry ejaculation. Understanding the why is the first move toward feeling empowered and taking real action. Reason number 1. The gate isn't holding, retrograde ejaculation. The most frequent cause behind dry ejaculation is what's called retrograde ejaculation. Here's how it works biologically. Imagine a tiny muscular valve sitting right at the neck of your bladder, acting as a gatekeeper. When climax hits, this valve is supposed to snap shut firmly, making sure the seminal fluid has only one route available, forward and out. But if that valve has become too loose, the fluid takes the path of least resistance and flows backward, straight into the bladder. You still feel the full rush of climax, but because no fluid actually exits, it registers as dry. One practical, non-alarming clue that this is what's happening is noticing your urine appears cloudier shortly after intimacy, since the fluid has now blended in with it. This kind of valve relaxation is commonly triggered by certain surgical procedures involving the prostate or bladder. These surgeries are often successful and necessary, but they can sometimes disturb the delicate nerve pathways that control that gate. It's also a recognized side effect of certain medications prescribed for high blood pressure or an enlarged prostate. These drugs work on your blood vessels, but in the process they can also loosen that small muscle. I recall one patient, a dignified man in his 60s, who was devastated after undergoing a successful prostate operation. He felt as though a piece of himself had disappeared. Once he understood that this was purely a mechanical shift, comparable to a traffic signal stuck on green, and that his desire and capacity for pleasure remained fully intact, the relief on his face was unmistakable. That same relief is within your reach too. Reason number 2, a clogged pipeline, duct obstruction. Our second leading cause involves a blockage somewhere along the ducts that carry seminal fluid. The underlying biology is fairly simple. The seminal vesicles and other glands are still producing fluid at a normal rate, but picture the small ducts as delivery tubes. When these tubes become obstructed, the fluid has nowhere to go. The amount released drops sharply or vanishes entirely, even though production behind the scenes is perfectly fine. These blockages often trace back to scar tissue left over from prior infections, such as a severe case of untreated prostatitis. In rarer situations, tiny calcifications, essentially small stones, can form and obstruct the pathway. Subtle warning signs to watch for include a new, mild ache in the pelvic region during climax, or noticing that the fluid has gradually grown thicker and scarcer over time. The encouraging part is that many of these blockages can be resolved, whether through medication that addresses inflammation or, when necessary, minimally invasive procedures that restore normal flow. This is not a permanent sentence, it's a plumbing problem, and plumbing problems get solved all. These surgeries are often successful and necessary, but they can sometimes disturb the delicate nerve pathways that control that gate. It's also a recognized side effect of certain medications prescribed for high blood pressure or an enlarged prostate. These drugs work on your blood vessels, but in the process they can also loosen that small muscle. I recall one patient, a dignified man in his 60s, who was devastated after undergoing a successful prostate operation. He felt as though a piece of himself had disappeared. Once he understood that this was purely a mechanical shift, comparable to a traffic signal stuck on green, and that his desire and capacity for pleasure remained fully intact, the relief on his face was unmistakable. That same relief is within your reach too. Reason number 2, a clogged pipeline, duct obstruction. Our second leading cause involves a blockage somewhere along the ducts that carry seminal fluid. The underlying biology is fairly simple. The seminal vesicles and other glands are still producing fluid at a normal rate, but picture the small ducts as delivery tubes. When these tubes become obstructed, the fluid has nowhere to go. The amount released drops sharply or vanishes entirely, even though production behind the scenes is perfectly fine. These blockages often trace back to scar tissue left over from prior infections, such as a severe case of untreated prostatitis. In rarer situations, tiny calcifications, essentially small stones, can form and obstruct the pathway. Subtle warning signs to watch for include a new, mild ache in the pelvic region during climax, or noticing that the fluid has gradually grown thicker and scarcer over time. The encouraging part is that many of these blockages can be resolved, whether through medication that addresses inflammation or, when necessary, minimally invasive procedures that restore normal flow. This is not a permanent sentence, it's a plumbing problem, and plumbing problems get solved all the time. Reason number 3, running low on fuel, hormonal causes. The third major area worth examining is hormonal imbalance, particularly low testosterone. Here's the science behind it. Testosterone acts as the core fuel source for the entire male reproductive system. It doesn't just influence desire and sperm production, it's also essential for the seminal vesicles and prostate to function at full capacity, since these are the glands responsible for the majority of the fluid volume. When testosterone drops to a meaningfully lower level, the whole system begins to slow down. The effects can be significant. At first, you might simply notice a smaller volume of fluid. But as time goes on, this shortfall can also show up as a dip in libido, erections that aren't as firm, and a climax that feels noticeably less intense. Beyond the bedroom, many men report fatigue, shifts in mood, and a gradual loss of muscle mass. Fortunately, the path forward is clear. This condition is often labeled hypogonadism, a hormonal deficiency that responds well to treatment. Once a simple blood test confirms the shortfall, carefully monitored hormone replacement therapy can often restore not just fluid production, but also energy levels, desire, and overall quality of life. It would be a mistake to simply write this off as an inevitable part of aging. I've watched men in their 70s return to my office after treatment and describe feeling like they'd been handed a second chance at life. That's not an exaggeration. That's what happens when your hormone levels are properly corrected. While the majority of these cases turn out to be manageable, as your physician, I also have a responsibility to flag the more serious exceptions. Dry ejaculation can occasionally point towards something more significant, which is why it's important to pay close attention to any accompanying symptoms. Here's when you need to see a urologist right away. If dry ejaculation shows up suddenly, without any clear explanation, and especially if it comes with pain, blood present in urine or fluid, fever, or a loss of feeling in the genital region, don't delay seeking care. These are warning signs that call for urgent evaluation. Certain neurological conditions such as Parkinson's disease, long-term uncontrolled diabetes, and in rare instances specific urological cancers, can all interfere with either the plumbing or the nerve signals involved in this process. I'm not sharing this to frighten you, I'm sharing it because catching things early makes all the difference. The men who fare best are consistently the ones who come in promptly, while treatment options are abundant and any damage still has the chance to be reversed. Beyond the physical side of things, we can't overlook the emotional weight this places on men. So many men link the presence of fluid directly to their sense of performance and masculinity. When that fluid disappears, feelings of inadequacy, anxiety, and frustration can quietly take hold. It becomes common for men to start pulling back from intimacy altogether, worried about being judged or feeling somehow less than whole. They withdraw from their partners. They stop initiating closeness. They suffer in silence rather than speaking up. Here's the emotional reassurance I want to offer you. The most powerful step toward breaking that cycle is knowledge paired with open conversation. Recognizing that this is a physical change, not a personal shortcoming, lifts an enormous burden off your shoulders. Your ability to feel pleasure, achieve erections, and experience genuine connection doesn't hinge entirely on whether fluid is present. Your intimate life can, and absolutely should, continue to be a source of real joy. I've personally witnessed marriages rescued simply because a man finally found the courage to open up to his doctor and his partner. I've seen confidence return. I've watched men look back into the mirror and genuinely recognize themselves once more. To bring this all together, I want to leave you with a clear, encouraging plan of action to help you regain control. First, don't dismiss it, get it checked out. If dry ejaculation appears suddenly or develops gradually over time, it's worth scheduling a visit with a urologist. In most cases, a simple medical history, a physical exam, and possibly a blood or urine test are all it takes to reach a clear diagnosis. Second, keep the underlying conditions in check. Managing chronic issues like diabetes, high blood pressure, and cholesterol has a direct impact on the vascular and nerve health that governs this entire process. Third, break the silence surrounding it. Speak candidly with both your partner and your physician. Opening up about what you're experiencing is genuinely freeing, and it clears the path toward real solutions. Remember, whether the answer turns out to be a medication adjustment or a specific medical treatment, professional guidance remains your strongest ally in restoring your confidence. To sum everything up, gentlemen, the absence of fluid during ejaculation does not spell the end of your intimate life, nor is it any kind of verdict on your masculinity. It's a message from your body, one that deserves to be listened to and properly investigated with professional guidance. Whether the root cause turns out to be mechanical, obstructive, or hormonal, understanding it is the first real step toward finding lasting peace of mind. I've personally watched countless men rebuild their confidence, restore their vitality, and rediscover joy in their lives after receiving a clear diagnosis paired with a solid action plan. Remember, your vitality was never meant to be measured in milliliters of fluid. It's reflected in your overall health, your well-being, and your capacity to live fully and connect deeply with those around you. Don't let hesitation or shame keep you from pursuing answers. Taking action at the right time truly can change everything. I'm Dr. Narita. Take good care of yourselves, gentlemen. I'll see you in the next one.